Good morning, everyone. It's April 16th, 2025. I am Dave Siever. Today, I'm going to talk to you about an exciting new technique. Well, I shouldn't call it new. It's just been sort of newly discovered technique on how to deal with severe chronic pain, both on a neurological level and also on a level dealing with the mind, in a sense, or maybe one's more a physiological level and the other one is more of a neurological level and mind. Anyway, I'm going to delve right into this and we'll get started right away here. So I'm going to share my screen and we're going to get going. So the effects of combined audiovisual entrainment and cranio-electro stimulation and dual frequency, CES we'll call it, on the opiate system in the treatment of chronic pain. So some basic stats about pain. These are American stats. Pain is a pervasive health issue that adversely affects both patients and society. The socioeconomic burden of pain conditions is a multifaceted problem with many involved stakeholders, not just the patient, of course, but psychologists, doctors, and so on. Conservative estimates of the healthcare costs associated with the management of pain conditions suggests an annual burden of $560 to $635 billion a year, and that was just that was done in 2020, and so it's terribly high. On a personal level, things get, of course, a lot worse in some regards. For most people with chronic pain, medical costs are nearly unaffordable. One study found that, well, we'll say 3/4 of people with high impact, that's severe pain where they're not able to work or anything, they're currently unemployed, and this obviously has a huge impact on a person's ability to afford medical treatment. In a U.S. Pain Foundation study, 75% of the responders indicated cost prevented them from accessing one or more treatment options that were maybe better than what they were getting that was covered by insurance. And so they could just take what they could afford through insurance. One study found that with severe pain, the average person spent $7,700 more on annual healthcare expenditures than people with no pain, which breaks down to about $650 per month. 50 million Americans are affected by this, and 20 million Americans are considered to have high impact pain, and that is so severe they cannot work or really engage in anything. So we're going to talk a little bit about two facets we're going to use to treat pain, and one of them is audiovisual entrainment. Now, this device here, the Premier, our new device, it does both audiovisual entrainment and it does cranio-electro stim in a unique way. Our older devices, the frequency of the CES was locked in to the frequency of the audiovisual stimulation. To properly treat the opiate system, or to activate the opiate system properly, we need to be alternating the cranio-electro stim at high frequency and independent completely of what the light and sound are doing. So in this case, we're going to be showing you what we can do with light and sound at the using it for depression while we're doing the CES for the opiate system. And so we're going to take a look at that. But first, a few things about audiovisual entrainment. First thing is, these are all the things that we know so far that entrainment does. You can adjust brainwave activity, the frequency. You can induce deep states of meditation and autonomic calming, and break the hypothalamic pituitary adrenal axis, which is basically your flight or fight axis. So many people with severe pain are in flight or fight all the time because they're hurting so much. And that's sort of a natural outcome. And anyway, we can increase cerebral blood flow. Again, that's impaired too. Lactate is impaired, anaerobic ATP. These are all impaired under severe stress and pain. We can balance neurotransmitters and help bring up serotonin again, and which is lost, and norepinephrine is also lost with audiovisual entrainment. We can excite glia and the neurons, and this is important too because we can help clean out deposits in the brain that are building up from poor sleep. And most people with pain have quite impaired sleep. We can increase heat shock protein, which helps the body to repair itself, activate specific non-inflammatory cytokines, mostly in the brain, and direct effects on the neuronal stamina, if you will, so improved cognition. And lastly, we have found that in Audiovisual entrainment stimulates the cerebrospinal fluid circulation through the lymphatic system. This is very important, again, in people who cannot sleep. The brain will fill up with deposits that cause further impairments and things like Alzheimer's and Parkinson's. And there is a way using audiovisual stimulation to activate the lymphatic system and clean out those deposits. So at least your increased risk of developing Alzheimer's or Parkinson's should be reduced. We currently have a Parkinson's client on it now, and he has made big gains in terms of being able to type and able to write. He can smell again, not everything, but his smell is returning, and he hasn't had smell for 15 years. So we're seeing good reversals using cerebrospinal fluid circulation techniques that are built into our new Premier device. Some things about depression, dopamine depletion, norepinephrine depletion, serotonin depletion, and hippocampal shrinkage, because brain-derived neurotrophic factor gets tuned down and causes these problems. Here's a study done by Sheely showing that with 30 minutes of entrainment using 10 hertz, they reduced wintertime levels of melatonin, which are tied to seasonal affective disorder. But the bigger things was they increased beta endorphins, they increased serotonin, and they increased norepinephrine. So cognition and a sense of good well-being and a reduction in pain perception are natural with using entrainment. And we've been using entrainment for pain for decades now. Here's an example of using it for depression. Now, this boy here had severe depression. You can see he's 8 standard deviations off of the norm here in slow alpha. And he was just pounded out. The poor guy was struggling so bad. He was a 19-year-old male. He was not able to attend school. He felt so bad. And he had some anxiety as well. And after one session of entrainment using an alpha beta protocol, where we we try to tune down the alpha in the left frontal areas, because that's where the happiness resides. And we try to keep it higher in the right side where fear and anxiety reside, and depression. And here he is after one session using an alpha beta protocol. So we did exactly what we were trying to do. And he noticed the difference immediately and was feeling a whole lot better quite quickly. Here's another study done by David Cantor and his student Stevens. I don't remember Stevens' first name, but anyway, they looked at 14 hertz audiovisual entrainment. And here they ran, this is the treatment group here, and they ran them for a month. And you can see how quickly and dramatically it brought down their Beck scores, their Beck depression scores. Of course, they only tested in 1 month. We don't know how fast they took them down in 1 or 2 days. They could have taken them down here already, but they did their test in 1 month. So it looks like it took a month to do it. Then they took them off and they put them on sham stimulation, and they still had improvements in their depression. Here was the controls who didn't get any entrainment here at 14 hertz at all. They got sham. And then when they put them on entrainment, they had big improvements there. So they're looking at it kind of both ways and showing the effectiveness. Again, this is 14 hertz. We have a tendency to use the alpha beta. That's what we use for our mood boosting. Anyway, there you go. Now, this is another study here looking at alpha. And this is a substance abuse study that was done by Ed Pygott, Greg Alter, and some of their colleagues. And they took this at Palm Beach Institute, Substance Abuse Treatment Center in Florida. And the Palm Beach clients attended an hour-long mindfulness meditation training that included, they call it AVS, audiovisual stimulation. Same thing. They were using our gear. And they did it 3 mornings per week for 4 weeks, so 12 sessions. And it was a 30-minute session. And there you go on our device. And they were basically using the depression protocol right here for mood boosting, okay, which is exactly what you want to use really for people with substance abuse issues. And they use the breath pacer that's incorporated in our devices and so on. And they were given the Beck depression scales and anxiety scales. And here they are here. So they were high responders and low responders. So these were the high responders. You can see Beck. This is the state anxiety and trait anxiety, the Beck depression here. So depression and anxiety is fairly high. After 12 sessions, a really significant drop in those symptoms of depression and anxiety. These here are mildly symptomatic people with substance abuse, and they improved as well, to about half for depression for sure, and maybe 20–30% for the anxiety. Okay, so 12 sessions, 3 times a week for 4 weeks, had the highest rate of clinically significant change after 4 weeks, although I would have recommended daily. But when people are outside the clinic, they can't always get in daily, so not always possible. Anyway, rumination and the worrying and such went down considerably, and they were maintained in the 3-month follow-up despite no further treatment. So it does have a holding effect, and that's nice to see. Now we're going to talk about the opiate system. So enkephalin and methencephalins, there should have been an I there. They were discovered in 1975. Beta endorphins, endorphin was discovered in 1976. Dynorphin was discovered in 1979. It took them quite a long time before they discovered endomorphin. So there's basically 4 opiates in the brain, and these have all been discovered. These are the time frames in which they were discovered. Well, we're going to show you a technique that can activate all 4 of these opiates simultaneously. Some of the work that has been done, looking at the neural pathways of low frequency and high frequency. Now they're calling it electroacupuncture because they were using 2 needles and they were putting them on any acupuncture point in the body. It didn't matter where they put them; they always had the same effect on the brain and on the opiate generation. And so we have found this by leaving them on the ears, and the ears have hundreds of acupuncture points on them. And the vagal, the auditory branch of the vagal nerve system, is also running through the ear as well. So we just use the ear, and we're getting very good results with this. So we don't need to do electroacupuncture, but that's kind of where the direction that they came from when they did these studies. So Wang and his colleagues have conducted a series of experiments to look at these things. Now they looked at, when they lesioned the arcuate nuclei, which is a little section of the hypothalamus, it abolished analgesia induced by low-frequency stimulation, but not that of high-frequency stimulation. So now they can tell which opiates are involved because they figured this out. And I'll show you that in a minute here. However, they also found that selective lesion of the parabrachial nuclei of the brainstem attenuated the effects of high-frequency stimulation at 100 hertz. This one, the arcuate nuclei, was 2 hertz. And I'm going to give you a little peek of what this looks like a little bit. So here is a study done looking at lidocaine injections of the arcuate nuclei. Now, the arcuate nuclei are involved with dulling down pain perception. And so when they injected lidocaine and basically numbed that part of the brain, pain perception was increased dramatically because it wasn't dumbing down the perception anymore. So that's kind of how this works. And similar studies have been done on the parabrachial nuclei of the brainstem. So now we're going to take a look at what happens when you stimulate the brain with electrostimulation. So here they looked at 2 hertz, 15 hertz, and 100 hertz. They found that at 2 hertz, they stimulated the endomorphins, the enkephalins, and the beta endorphin. At 100 hertz, they stimulated dynorphins. 15 hertz provided a modest stimulation of both, but they could get strong stimulation at 2 hertz of these, and of the dynorphins, strong stimulation at 100. So they thought, well, why don't we try this? We will go 2 hertz, 100, 2 hertz, 100. It takes about 3 seconds to activate and then sort of plateau. And so if they alternated every 3 seconds, they were able to have full activation of these 4 opiate systems and use them for pain. So here's some stuff here. They're looking at before and after stimulation. And we can see here that there was a 7-fold increase in menencephalin, but not dynorphins here. And then over here at the high frequency, we were getting a much different appearance or effect. And 15 hertz did a modest, as you can see down here, did a modest sort of amount of both. So that's kind of what we're looking at here, 2 hertz, 15 hertz, and 100, 215 and 100, and we can see how it activated the different opiates. So a very telling slide for sure. So on our device, so this is the programming software I use when I program all the sessions into our device. And this is a 1 minute window from 8:04, 8 minutes. I just picked 8 minutes into the session to 9 minutes into the session. And you can see it, we're going 100, we're going 2, then 100, then 2. Actually, we do 100, 2, 100, 2, 3 seconds each. So 3, 6, 9, 12, plus 1 second to transition. So that burns up 16 seconds. And then we do 14 seconds or so at 15. Right here, we see it. And then we cycle back to 100, to 100, and then 15. And this is just the graph that shows how it's bouncing around back and forth. So when we do a 30-minute module, let's say using the, in this case, the depression or the mood boosting session, we have hundreds and hundreds of modules. There's a lot of stuff going on that device, on the David Premier. Just lots of stuff is going on to help reduce pain. And this is what it looks like again. It has a nice screen on it. It's fully programmable. There's a little SD card in the side, and when you get it, I recommend you take that little micro SD card out. You can dump all your sessions into your computer and put them in a folder. And you can even run the lights right off your computer, off the USB port, if you feel like running off your computer. And you can use the sounds that come off your computer. They're identical to what comes off the box. So anyway, there you go. I want to thank all of you for attending my lecture. Thank you very much. I was able to convey everything you needed to know about how the system works at reducing chronic pain and also reducing depression that's associated with chronic pain. Also, when you reduce depression, like it's always been shown, if you can improve mood, the perception of pain goes down. And that's part of the reason why we want to tackle both at the same time. That being said, we also have one other session here that uses alpha. And you can use the alpha protocol or you can use the mood boosting protocol, either one. Okay, well, thank you very much for attending my lecture. I'm going to turn off the sharing here and we can chat a little bit if you like. Thank you. Okay.
I just wanted to share
Hey, Krishna.
This one. I'm running this right now, the dual action.
Yeah, that's the pain one. I see that. Yeah.
I've got my Cranio-Electro Stimulation ear clips on, and I was running this session during the Zoom.
I think it was an advanced the machine than what we've been using. So I've been using your ABE and CES for quite some time in my clinic.
Okay. Oh, nice. Thank you. Yeah.
So I just wanted to understand what's this new introduction from your side.
So you're talking about the David Premier?
Premier, yeah.
Yeah, there are 2 pain sessions in the Premier. Yeah, one with alpha, and the other one is with the mood booster.
Okay. So this is a new level entry, new product?
Yeah,
Pardon?
the David Premier is a new product. It's a step up from the David Delight Pro. I think you're using the David Delight Pro at Life Shots.
Pro.
Yeah.
Yes.
True.
And the Pro cannot do it, unfortunately. It just did not have the ability at all to do what we can do with this Premier by having 2 sets of frequencies running at the same time. And we use those for other things too, not just for pain, but we do other things with this as well.
Okay.
Those are the entrainment session of 51, yeah.
So what are the new indications? It's majorly for autism or ADHD or for stress, depression, anxiety, sleep disorders. These are the indications which we've been talking about all along.
Well, you know, it does a lot of what the previous devices have done, but the pain are the one thing that can do that the other one couldn't do with the opiates. And also, we have ability now to pump cerebral spinal fluid. And we are really impressed with that. And I think that's going to be a big one for post-concussion syndrome, Parkinson's, stroke, and Alzheimer's.
Ah, that's a lot indication, because these are
Yeah,
the regular
yes,
indications we come across in our
yeah, yeah.
clinic.
I did lecture on that last week, and that we do have the lecture is recorded, and it's on our website under training, right?
If not, you can just go to our YouTube channel, Mind Alive Inc. on YouTube, and all the videos are there.
Okay. So
You can,
definitely, I need to, put somebody on the job to, handle this department. I've been using it personally because I used to use this and I used to handle the way I got benefited with it. But now I think it's becoming more detailed one. We have too many technologies, but I need somebody who understands this brain entrainment
Sure.
technology in more detail. So I'll definitely spare some time, and I see a big a demand for all these kind of technologies, and the indications what you have mentioned. I'm going to be, I'm very sure that it has a big demand in India now, because
Yeah.
being a rehab center, we have a lot of patients coming with concussions or maybe stroke. These are two major indications we wish to utilize.
Yeah. Well, this device also does transcranial DC stim as well. If you order that as an add-on or an accessory, and yeah, we can see I mean, we've been using this for concussion and stroke and stuff, and Alzheimer's and Parkinson's for several years. But the pumping effect seems to be that it's working somewhat faster, a fair bit faster than the standard, typically SMR betas that we do use. Although they've worked quite well, the pumping thing I think is going to be a really big deal. And we've got several people experimenting it right now. And I got to say, our Parkinson's client, he was on a standard SMR beta, or I think it was actually the brain booster for a year. And he had improvement in his typing, had improvement in his handwriting to some degree, and his motor control. Then we got him on the pumper in January, and it didn't take long, and he had a much bigger improvement in his handwriting, and he could start to smell again.
And any contraindications which I need to be sure about?
pacemaker. If a person
Yeah,
has a pacemaker,
And
nobody
maybe
with
the
a
pregnancy.
pacemaker can use the electrical stimulation, any type of like TDCS or MET also.
Okay, only one contraindication, I guess, other than pregnancy.
Yeah, I don't remember we any warnings we put in the front of the Premier manual. If you'd like, I've shared my email address. It's education@mindalive.com. If you send me
Okay.
an email, I'll send you a copy, a link to the online David Premier manual, and you can read all the contraindications in the front cover. Like after exercise, people will put their legs into these leggings and they inflate and they help
Yeah,
with,
yeah.
if
We
you have
also have
those,
that.
this is great to have them running that at the same time while they're just lying there having that treatment. They can run a session.
Lymph press. I have done that several
Okay.
times.
Yeah.
Because I know that that is the time the people just want to rest and a lot of blood circulation happening. And that's the
Yeah.
time CES makes them, icing on the cake.
Yeah. You can put those two together. They would work very well together.
So this new technology which you have now introduced, it's not
So
very
this,
difficult to use, right? It's not very difficult to use.
no, I've been
no,
using it
no.
while we ran the session.
Yeah,
You
the
just,
session's already on the device. You can just play
yeah.
them.
Hmm. Okay,
Yeah.
so there is no need of too many, handling in that. Different hertz for different indications.
No, on the device too, because it has a digital display. Everything is in categories that are nicely arranged, so it's somewhat nicer to use than a Delight Pro. You can also activate background sounds, because a lot of people are a little edgy when they're first on it, or it sounds a little mechanical, or ocean waves, or birds, or chimes. We have about, I think, maybe 8 background sounds that you can pick, and we can
Mhm.
add more, and you can add your own as well. And it makes a big difference in terms of how comfortable and how relaxed people feel when they run it, at least for their first couple of times. I use it a fair bit still, and I always use the babbling brook. That's my that or the ocean waves are my two favorite ones.
Yeah. Thanks a lot, Dave, and you're doing a great job. And hopefully, looking forward to see you in India soon.
Yes, and thank you very much
for. India is a big market for you. India is a very big market for you. Only thing is, it's a little technical, and it's about mental health, so it's going a bit slower because people look for more of a technology which can magically work with them. The cryotherapies, the float therapies, that's what has really been picking up. But I am very much passionate about your product line.
That's good to hear.
Yes, thank you very much for believing in our technologies. I do appreciate it.
For sure. Maybe we are slow, but definitely catching up.
Yep.
Thank you. Nice talking to you. Bye-bye. Have a nice day.
Yeah,
thank you.
Same to you.
Yeah.
Good evening. Yeah.
Bye-bye.
Bye-bye. Well, thank you everyone for attending this webinar. I do appreciate it very, very much that everyone loves to see what we do and has faith in that we know what we're doing. I do appreciate it so much, and I wish you all a wonderful rest of your day, and hopefully we'll see you in the future. Thanks. Bye-bye.